Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Tremfya Guselkumab Subcutaneous Tremfya Guselkumab is an injectable prescription medicine used to treat plaque psoriasis and psoriatic arthritis in adults. Tremfya belongs to a group of drugs called monoclonal antibodies. It works by decreasing naturally occurring substances in your body that can lead to inflammation and worsen your symptoms. /r/n/r/n Tremfya is available as a subcutaneous, under the skin, injection and is administered using a needle. /r/n/r/n GenericNameGuselkumab /r/n/r/n NamesTremfya /r/n/r/n Drug availability. Prescription /r/n/r/n Therapeutic classification, monoclonal antibody, IL-23 inhibitor /r/n/r/n-available generically no /r/n/r/n-controlled substance N/A/R/n/r/n-administration RouteSubcutaneous /r/n/r/n-active IngredientGuselkumab /r/n/r/n-dosage FormsSubcutaneous prefilled syringe, subcutaneous OnePress injector /r/n/r/n Tremfya is used to treat adults with moderate to severe plaque psoriasis who are candidates for systemic therapy or phototherapy. Plaque psoriasis is the most common form of psoriasis and causes red, scaly patches, plaques, to form on your skin. People with plaque psoriasis often experience significant itching that can interfere with their quality of life. /r/n/r/n Your healthcare provider may consider Tremfya if your plaque psoriasis symptoms are too severe to be controlled by topical, on-the-skin, treatments alone. /r/n/r/n Tremfya is also approved by the Food and Drug Administration, FDA, to treat adults with psoriatic arthritis. Psoriatic arthritis is an inflammatory form of arthritis that most commonly affects people with a history of psoriasis. People with psoriatic arthritis often experience joint pain, stiffness, and swelling of their fingers or toes. Other symptoms, such as skin plaques or nail problems, can also occur. /r/n/r/n Very well. Zoe Hansenrnrn Tremfya is an injectable medicine that you or your healthcare provider will administer subcutaneously, under your skin, using a needle. An initial dose is given, and then second dose of Tremfya is given 4 weeks after the first. After that, you'll only need to receive Tremfya every 8 weeks. /r/n/r/n Tremfya is available as a prefilled syringe or OnePress injector pen. Each syringe or pen contains 1 dose and should only be used once. You may receive your Tremfya dose at your healthcare provider's office, or they may train you to administer your dose. /r/n/r/n If you inject Tremfya at home, follow these steps to ensure that you receive your dose safely. /r/n/r/n Store your Tremfya prescription in the refrigerator, 36 degrees to 46 degrees Fahrenheit, in its original carton packaging until it's time for your dose. Never freeze or shake Tremfya. /r/n/r/n Tremfya takes time to work. You may notice an improvement in your symptoms after 12 weeks of treatment. /r/n/r/n This is not a complete list of side effects and others may occur. A healthcare provider can advise you on side effects. If you experience other effects, contact your pharmacist or a healthcare provider. You may report side effects to the FDA at fda.gov/medwatch or 800 FDA 1088. /r/n/r/n You may experience side effects from Tremfya that may go away within a few days or a couple of weeks. Let your healthcare provider know about any side effects that bother you or don't go away. /r/n/r/n Common side effects include /r/n/r/n Though rare, Tremfya may cause serious side effects. Contact your healthcare provider right away if you develop any signs of a severe reaction. Call 911 if your symptoms feel life-threatening. /r/n/r/n Serious side effects and their symptoms include /r/n/r/n allergic reactions. This includes a serious and sometimes life-threatening form called anaphylaxis. Stop using Tremfya and seek medical care if you develop any of the following: /r/n/r/n serious infections. Tremfya may weaken your immune system and make it harder for your body to fight off infections. Your healthcare provider will check you for infections, including tuberculosis, before starting Tremfya. Let your healthcare provider know if you notice any signs of an infection, including /r/n/r/n Tremfya may cause other side effects. Call your healthcare provider if you have any unusual problems while taking this medication. /r/n/r/n If you experience a serious side effect, you or your provider may send a report to the FDA's MedWatch Adverse Event Reporting Program or by phone, 800-332-1088. /r/n/r/n form. /r/n/r/n Tremfya is administered as a single-dose solution in prefilled syringes or OnePress injector devices, injected under the skin. /r/n/r/n Dosage. /r/n/r/n For Plaque Psoriasis, the recommended dose of Tremfya is 100 mg, mg, injected every 4 weeks for the first 2 doses and every 8 weeks thereafter. /r/n/r/n For Psoriatic Arthritis, the recommended dose of Tremfya is 100 mg, mg, injected every 4 weeks for the first 2 doses and every 8 weeks thereafter. /r/n/r/n The following modifications, changes, should be kept in mind when using Tremfya. /r/n/r/n Adults over the age of 65 years, during clinical trials, Tremfya was just as safe and effective in older adults as in younger adults. However, because only a small number of clinical trial participants were adults over the age of 65, it's possible that differences may exist. Let your healthcare provider know about any side effects or concerns you have. /r/n/r/n Children, Tremfya has not been studied in children and is only approved to treat adults. /r/n/r/n Lactation, it is not known if Tremfya passes into breast milk or what effect it would have on a breastfed baby. Talk with your healthcare provider and your child's pediatrician about ways to feed your baby. /r/n/r/n Pregnancy, Tremfya has not been studied in pregnant people, and the effect of Tremfya on a fetus is unknown. Let your healthcare provider know if you're pregnant or plan to become pregnant before starting Tremfya. /r/n/r/n If you forget to inject your dose of Tremfya, administer it as soon as you remember. Inject your next dose at the regularly scheduled time. Call your healthcare provider if you are unsure when to take your dose. /r/n/r/n If you inject more than 1 dose of Tremfya or inject your dose too soon, call your healthcare provider. They may recommend monitoring you for side effects. /r/n/r/n If you think you or someone else may have overdosed on Tremfya, call a healthcare provider or the Poison Control Center, 800-222-1222. /r/n/r/n If someone collapses or isn't breathing after taking Tremfya, call 911 immediately. /r/n/r/n Tremfya may not be right for you if you have certain medical conditions or other factors that affect your health. Talk with your doctor about your health history before you take Tremfya. Factors to consider include those described below. /r/n/r/n Allergic reaction. If you have had an allergic reaction to Tremfya or any of its ingredients, you shouldn't take Tremfya. Ask your healthcare provider what other medications are better options for you. /r/n/r/n Infection. If you have an infection now or have had infections in the past that kept returning, you shouldn't take Tremfya. Be sure to tell your healthcare provider if you get any infections while taking this drug. /r/n/r/n tuberculosis, TB, you shouldn't take Tremfya if you have TB. /r/n/r/n you should not take Tremfya if you are allergic to Guselkumab or any other ingredient in Tremfya. Ask your pharmacist or healthcare provider for a full list of the ingredients if you're unsure. /r/n/r/n before starting Tremfya, let your healthcare provider know about all the medicines you take or plan to take, including prescription medications, over-the-counter, non-prescription, products, vitamins, herbs, and plant-based medicines. /r/n/r/n certain vaccines, live vaccines, may not be safe to take with Tremfya. Talk with your healthcare provider about getting any necessary vaccines before starting Tremfya. /r/n/r/n Tremfya is a monoclonal antibody, a lab-made protein that binds to special cells in your body. It works by blocking substances in your body that contribute to inflammation. Another monoclonal antibody that works similarly to Tremfya and treats plaque psoriasis and psoriatic arthritis is ustekinumab. /r/n/r/n like Tremfya, Stelara is a subcutaneous injection, given under the skin, but it's given every 12 weeks instead of every 8 weeks. Unlike Tremfya, Stelara is approved to treat children 6 years and older with moderate or severe plaque psoriasis. /r/n/r/n Tremfya is an injectable medication used to treat adults with moderate to severe plaque psoriasis or active psoriatic arthritis. /r/n/r/n Tremfya works by blocking naturally occurring substances in the body that can lead to inflammation and contribute to your symptoms. /r/n/r/n Some people may notice improvements in their symptoms after at least 12 weeks of treatment. /r/n/r/n The most common side effects of Tremfya include upper respiratory infections, headache, injection site reactions, for example, redness, bruising, swelling, itching, pain, discoloration, and hardening of the skin, and joint pain. /r/n/r/n If you're struggling to get your plaque psoriasis under control, topical medicines on the skin, may not be enough. Your healthcare provider may discuss starting a biologic treatment such as Tremfya. /r/n/r/n Tremfya is highly effective and can help you achieve clearer skin and improve symptoms such as itching, burning, and pain. But because Tremfya targets your immune system, you may be at an increased risk of developing infections, which can sometimes be serious. Talk with your healthcare provider about warning signs. And contact your healthcare provider at the first sign of any problem. /r/n/r/n It's worth noting that vitamin D deficiency has also been noted in people with psoriasis, especially during the winter. Be sure to talk with your healthcare provider if you have questions about your vitamin D status, or if you want to know more about using vitamin D with Tremfya. /r/n/r/n Very well, health drug information is meant for educational purposes only and is not intended as a replacement for medical advice, diagnosis, or treatment from a healthcare provider. Consult your healthcare provider before taking any new medications. IBM Watson Micromedex provides some of the drug content, as indicated on the page. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.